When caring for patients with traumatic injuries, the radiographer must use extreme caution when making initial diagnostic images, because the slightest movement may cause severe injury. With the trauma patient, the cross-table lateral cervical spine is common and obtained immediately on the patient's arrival to the emergency room to rule out fractures, dislocation, or other abnormalities. Patient assessment and critical thinking is essential for achieving diagnostic outcome images under trauma circumstances. After assessment is made, the technologist checks for patient identification and confirms the X-ray order. Remember, do not remove the cervical collar and do not move the head or neck until a physician has evaluated the images. If the patient is stable and if the department protocol allows, move the gurney and place it in an area where you can achieve 72 inches source to image distance or departmental standard distance. If the patient is conscious, inform the patient of what will take place and the protocol of a cross-table lateral cervical spine. Obtain the appropriate size image receptor and grid. Place the image receptor and grid in a cassette holder and place it crosswise so that the long axis of the image receptor lines up with the cervical spine. Place the holder as close as possible to the patient's shoulder and center the IR 1 to 2 inches above the EAM. Ensure that the image receptor does not move or fall. Set up the X-ray equipment and turn the tube to obtain a horizontal beam directed perpendicular to the cervical spine. Collimate on all sides to the neck tissue borders to include the anatomy of interest and to decrease patient dose. Shield the patient and give the patient instructions on what will occur next. Give appropriate breathing instructions and have the patient suspend respiration on full expiration to help depress the shoulders. Remove the image receptor and inform the patient that the image will be processed and available for the emergency room physician to view.